So good evening, everyone. You're most welcome once again to this session of the Skin NTDs webinar and webinar series rather. And we've come a long way. We're almost through with the series. And this webinar, we're going to be discussing the DENSA app and the WHO Skin NTDs app. And this is very essential to the program that we are having because we need people to begin to report, these cases of skin NTDs where they are seen in their communities, or they walk into your pharmacy, or they walk into your health center, and they are not really sure. So the Skin NTDs app is a very good resource. And then the DENSA app is like a teledermatology app where you can actually send a photo to a dermatologist and get further clarification or advice on what to do with a particular skin condition that you come across. And there's also a place in the app for you to be able to notify the local health authorities for notifiable diseases. So we'll take it one by one. But the first thing I would like to start with is to go through how to take proper photographs. And that's very essential with dermatology because we realize that a lot of people don't know how to take photographs. And so they take the photograph and the photograph is not helpful, or it's, it's useless basically. So I'm going to start by taking a presentation on how to take good photographs, which is very essential. And then we'll open up the apps the app together, both apps together, and go through. So let me join in on my phone as well, so that I can use my phone for the app, for the WHO Skin NTD app. But before we start, we'll just take this short presentation on how to take clinical photographs, which is very essential. A lot of us actually don't know how to take clinical photographs, so doing this just like a short overview of this, I hope will be helpful. So we want to acknowledge and thank once again the International League of Dermatological Societies and the International Foundation for Dermatology, who have facilitated this training series and the further development of the DENSA app through the DermLink grant, and we're representing the Nigerian Association of Dermatology for this webinar series. So my name is Dr. Cole-Adeife. I'm a dermatologist at LASUTH in Ikeja, and so we know what teledermatology is. We had an introductory lecture at the beginning of this series, and we know that teledermatology is a way in which dermatological consultations can be done remotely via mobile phones or computers, and it also involves the teaching and training, like what we're doing. The lecture series also can be classified as some form of teledermatology training or teaching. So it's something that can bridge the gap, the expertise gap, where a dermatologist is physically unavailable. However, the major challenge with teledermatology is the quality of photographs. So a clinical image that is not properly taken can actually defeat the purpose of the teledermatology. And, it may be difficult to make a diagnosis of a case or via pictures if the picture is not properly taken. I've had several people send photos to me, my colleagues and other people. Oh, can you look at this rash? What do you think? And the quality of the photos just makes it impossible for me to be able to offer any form of, advice or have an opinion about it. So it's very essential. And most of those cases, I usually tell them to please, retake the photograph, retake the picture, and send it with better lighting and all that. So it's really very essential that people engaging in teledermatology know how to take photos. So before taking the photo, it's very important to get consent. If you are taking a photo of your patient, please ask. Don't just bring out your phone and take a photo without getting their consent. If you know that for us that do teaching and education and write papers on, in dermatology, we're also required to get actually a written informed consent. That's using a paper and pen and patient signs, so that's very essential for confidentiality and for legal purposes. And then, but if it's just for clinical care, maybe you're just trying to treat your patient, this may not be essential, so to speak. So verbal consent is, very maybe sufficient for that. You may not need to take a photo. Take informed consent. However, this varies in locations, and it's just best if you have the wherewithal in your clinic. You should have a photo consent form in your clinic, and that form can be used to take pictures. That form can be filled before you take pictures of your patient. So the first step is that you want to take well-lit photos. Natural lighting is very essential. The gold standard, like sunlight, but where that is not applicable or possible, then you can use fluorescent lighting to take the photos. Then use a flash only if the area is not well lit. So if the area is well lit, you may not need to use a flash. And then you want to remove identifiers and unnecessary objects like jewelry, shoes, clothing, and other such objects where before you take a photo. Particularly, you don't want anything that a person can be associated with, so that you can maintain some degree of confidentiality. So, and you want to de-identify the photograph. Then it's always better to put like a plain background for behind the part of the skin to be photographed. So if you are photographing maybe someone's hand, for instance, it's best that you put it, the hand behind like a paper or a cloth, or put a paper or cloth behind the part of the body you want to photograph, so that you don't end up having a very busy background that might distract from the actual photo. But this is not needed in all cases. It's needed if, the area does not fully cover the frame. For instance, if you're taking a photograph of the back, you may not need to have a background. But if it's like a hand, or an arm, you may need to put something behind, and I'll show you examples of that shortly. Then also, you need to, when you are using a background, it should be as close to the skin as possible, actually to be maybe in direct contact, because if it's not, you may have shadows on your photograph and it may not be helpful. Then you want to hold your phone very steady. We get a lot of blurred photographs which are not held with, taken properly. Maybe your hand is shaking, or you're using one hand to take the photograph. You may not get, a good quality photograph. And you want to make sure that your camera is parallel to the skin. So it shouldn't be at an angle. Where it's at an angle, you may not get the best outcome. And you can focus your photos by touching the screen. Sometimes the phone may want to focus on something behind what you're actually trying to take a picture of. But if you touch the screen, it would, most smartphones would have autofocus. And if you touch your screen, that can help you to autofocus onto the actual image that you want to, picture. Please retake the picture if it's blurred. So you have to look at what you have taken. If you can't see it very clearly, it's not likely to be helpful to a dermatologist. So please try to retake the picture. This and take more than one photo and from different angles, very essential. And you can zoom in and out to get different representations. And this is what I mean. If you can see the photos in this picture, this is a photo of the patient's two hands. This is a patient with Gottron's papules from dermatomyositis. It's not an NTD, but I'm just using it for illustration. So we took a photo of the two hands to show the overall representation of the hands, and then we zoomed in to take a much closer, so that we can actually look at the nail beds. We can see the telangiectasia and just at the nail bed there. So This detail will be helpful for somebody who wants to make a diagnosis. These are pictures of a patient with leprosy, and you can see that the image is blurred a little bit here, but it's quite visible and it's almost parallel. That's they are directly in front of the patient when you are taking the lesion. This is another patient with leprosy. You can see the ulceration, digital ulcerations, and the camera is right in front of the patient. So you are parallel to the patient. When you take at angles, you kind of lose out with some of the detail. This is another example of the patient, we have taken from different perspectives, and the camera is directly above the foot. This is a case of Madura foot. So that is also there. So you want to make sure that your camera is directly parallel above the foot. Or whatever part of the body you are taking a photo of. Now you need to maintain confidentiality by blurring out the patient's eyes most of the time. Once you're able to blur out the eyes and take away any identifying objects around the patient, you are helping the patient to maintain confidentiality to a great extent. So this is also very essential. So this is with a flash. So this picture was taken in where maybe the natural lighting was not sufficient. And there are some conditions that the flash will help to accentuate the skin condition. This is a case of seborrheic dermatitis, scalp seborrheic dermatitis. So you can see that the flash has actually helped to delineate. And this patient, the flash was not used because the room was well lit, so you can actually see the erythema and the scaling. This is also a patient with seborrheic dermatitis that was filmed. Sorry, my apologies. Today is Sunday. I'm multitasking, so I'm alone with my infant. So I'm trying to multitask while taking this lecture. Apologies. So yes, you can see that this is without the flash and with the flash. So the flash is not used in the second photo because the room is well lit. So that's fine. So next slide. It's not going to. Okay. So these are poorly taken photographs, and I'll give you the reasons why they are not ideal or not well taken. The first photograph, you can see the background. It's too busy. There's a lot of the chair and everything. So ideally, you shouldn't take photos like this. Better we put something behind the affected parts before taking the photo. And then the second photo is a case of scabies. This case is a case of query oncodermatitis, and this is a case of query scabies. But the ring is still there, and the ring is an identifier. So you don't want to leave a ring on when you're taking a clinical photograph of a patient. You prefer to ask the patient to kindly take off the ring if they can. Now, these are blurred photographs, very blurred. And these photographs were actually sent to me for me to look at and to give an expert opinion. And I had to apologize and say, I'm sorry, these photographs are not clear enough for me to be able to give any expert or clinical opinion. Kindly retake them. And then this first one you can see was taken at an angle that is not appropriate. So you want to make sure that images are the camera is parallel, like we mentioned, so that we don't have funny angles like this. So these are examples of what we don't want. Okay, so that's all. So let me just quickly go through the photos again for those just coming into the session. So just a recap: well lit photos, Use the flash only if the area is not well lit. Remove identifiers. Put a cloth behind the part of the body to be photographed. That's if it's not a full body that takes the whole field. And make sure the background is in contact to avoid shadows. Hold your phone steady with both hands. And make sure the camera is parallel to the skin. Focus your photos by touching your phone. You can touch the phone screen focus. Retake if it's blurry. Take more than one photo from different angles. Zoom in and out, like this to get different representations of the skin lesion. And these are examples. So these are cases. This is a case of leprosy. This is a case of Madura foot. This is not an NTD. This was a query leprosy, but it was more of cutaneous T-cell lymphoma. It wasn't leprosy. And this is seborrheic dermatitis. This is oncodermatitis on the left, scabies on the right. These are not very well taken because the background and the identifiers. And these are blurred photos. So that's why. So that's just a brief breakdown of that, and then we'll go to a practical session where we'll try to look at the WHO Skin NTDs app first, and then we'll look at the Denser app second. Okay, so I'm going to stop sharing my screen so that I can share on my phone. So please just give me 1 or 2 minutes. If you have any questions, please put them on the Q&A. You're welcome, Dr. Seb. I'm just going to enable my phone to be here because I will not be able to put up the app on my laptop. Just 1 minute, please. Thank you.
I must also add that I think it's good that this session is done because we get a lot of these pictures, especially those inappropriate and blood pictures. And many people get angry when the dermatologist doesn't give them what they want or says, oh, sorry, I can't make anything out of this. They're like, oh, what's your problem, sir? So I think it's good that you've given this highlight so people have an understanding of what is expected whenever you do teleconsultation or teledermatology seeking opinion of a dermatologist. We should not just send pictures that would not help the dermatologist to make any impact at all. Okay, I see that the Skin NTD guide app is up. All right. I think you should continue, Dr. Cole.
Okay, thank you very much. Can you hear me? Am I audible, Dr. Oiwa? Dr. Nafisa?
Yes, you are. You're very
yes, Dr. Cole, you are perfectly clear.
Okay, thank you so much. So this is the Skin NTDs app. Can you see my screen, please?
Yes, we can.
All right, so we're going to go through it. So when you go through it from the App Store, just let me show you, this is it on my desktop, on my phone. If you want to download it, just go to the Play Store. I'm using a Samsung, but if you're using an iPhone, you just go to the Apple Store and download it. So you could just type in WHO Skin NTDs app. So I'd like us to try it. Those of us on the call, and you see it here, Skin NTDs app. That's it. The third one. So if you're able to download that now, you can do that. This is it here. If it's not installed on your phone, you get the message to install it. I'm sure we all know how to install apps on our phone, so let me leave that. But I'd like us to install it so we can go through it ourselves. Then, so this is what you get when you open it. Now, it has an overview of all the skin NTDs. Really also cutaneous leishmaniasis, color erythema, leishmaniasis, leprosy, lymphatic filariasis, mycetoma, osteoarthritis, KB, tongiasis, and yours, podoconiosis, homoblastomycosis. Yeah. So you can open each one of them. It gives a description of that NTD. So it's just like an overview of what the causative organism is, the mode of transmission, the clinical presentation, and all that. But it doesn't talk about treatment. So it's also, if you look further, it will show you the location where these NTDs are endemic. And you can see that for Broly ulcer, you can see that Nigeria has a case number of 424 reported cases according to the WHO. So you can see all the countries where it is, and then you have a photograph of what a Broly ulcer looks like, at least in one stage of the ulcer. So that's basically for each of the NTDs. You have that detail, the description. This is cutaneous leishmaniasis, the location. As you can see, in Nigeria, there's no data as we discussed in our webinar on leishmaniasis, even though we know we have cases. And that's because we are not reporting them to the relevant authorities. So by the time we start reporting them, probably there will be more data on Nigeria for this, because you can see all the cases here and the locations. And then you also have a picture of it also shown there. So that is how it works. So what it basically does is an aid. So if you see a case and you are not sure, you can just come to this as a resource to get more information about it. So that's the first step. Then we have different countries here. You can pick your country. We're in Nigeria. So if you go to Nigeria, you see what is endemic in our country, or what is written here as being endemic. So you can see that endemic, we have Broly ulcer, cutaneous leishmaniasis, even though the precise number of cases are not available, leprosy, lymphatic filariasis, mycetoma, and onchocerciasis, and KB, tongiasis. So they're all there. They're where there's no data. Talk about yours and podoconiosis. So that's the WHO current status for our country, Nigeria. So when you want to make a diagnosis, this is a bot that can help to this bot is designed to help you in the diagnosis of skin NTDs. So lumps, then ulcers, swollen limbs, and patches. So depending on what you see on your patient, if you see a lump, you look at the description of what a lump is and which NTDs present as lumps is there, whether it's yours usually starts as a lump, onchocerciasis starts as a lump, like nodules, Broly ulcer also starts as a lump, leishmaniasis, leprosy, mycetoma. So all these NTDs are associated with lumps. So that's how you can kind of have an idea. But if the patient presents with an ulcer, for instance, you can see this is the description of what an ulcer is for those who are not sure. And then you can then see which of the NTDs presents with an ulcer. And you see them there, Broly ulcer, cutaneous leishmaniasis, yours, and leprosy. Then lymphatic filariasis can also develop ulcers in the later stages. So you want to look at all the possibilities of ulcers when you're thinking of a skin NTD. So that's for ulcers. Then for swollen limbs, you want a description of what a swollen limb is. And, this talks about swollen limbs and the NTDs associated with swollen limbs. So with swollen limbs, you have Broly ulcer, podoconiosis, mycetoma, lymphatic filariasis. So when you have a swollen limb, these are the 4 skin NTDs that you'll be thinking of. And then you also have a picture for assistance. So that's perfect. Then patches. So it describes what a patch is. You have a distinctive area of skin that's either raised above the skin surface. So a definition of what a patch is. You don't need to read it out, it's there. And then which of the NTDs present with patches. So you have leprosy, onchocerciasis, leishmaniasis, post-Cole-Adeife, dermal leishmaniasis, and yours. These are entities that can all present with patches. And then you have a photo there as an example, but that photo is not really a patch. I think we should change that picture. So that's basically skin sign. So when you see a patient with a particular skin sign, this app can help you to narrow down your possible diagnosis, particularly for people who are not so familiar with NTDs or skin-related concerns, so to speak. The app is very useful. And then this is distribution. So, and how, each NTD, usually where the location of the particular skin lesion that is associated with that skin NTD. This is like a graphic representation of that. So you have lumps, ulcers, swollen limbs, and patches. Cutaneous leishmaniasis can present as lump, ulcers, swollen limb, and patches as well. So that's what you see. So you find that post-Cole-Adeife dermal leishmaniasis is not associated with swollen limbs or ulcers, but it can be associated with lumps and patches. So in leprosy, there are lumps, ulcers, and patches, but no swollen limbs. Lymphatic filariasis can have everything, but mainly the swollen limbs. So you can see the plus there. So that's how everything has kind of been broken down to try and help with differential diagnosis when you are seeing a case of a possible case of an NTD. Okay, so that's basically it. So this is like a chat box. So it's kind of like our diagnosis. So do you want to make a query based on your specific country or group of countries? You can click either yes or no. So pick the sign thing. So you can pick what you see. How many of the lumps, how many skin ulcers, how many skin ulcers, how many swollen limbs, and then how many patches. So all this is what you can actually, if for instance, you say, yes, you put Nigeria. So it will just help you to narrow down the possibility of what you are seeing on the field. Pick the skin sign. Okay, so let's say in Nigeria, see some with lumps, maybe 1 to 3. It's asking you, are they solid lumps or soft containing pus? Let's just say they're solid lumps. So these are possibilities that you get. Onchocerciasis, really also cutaneous leishmaniasis. Let's see if you can add some other diagnosis. If you pick swollen limbs or face, unilateral or asymmetrical, that's one side. Then we show results. It's likely to be lymphatic filariasis, mycetoma, or Bruni ulcer. If I pick bilateral, it will probably tell me protocols, because that will give me bilateral limb swelling. So you can see that it's a resource that can be used on the field, people that do outreaches, people that work in remote settings. It's really helpful. And this is a chatbot where you can actually send messages. It's like AI. AI has come to the world, take over everything. So you can ask for more information about any of the NTDs here using the chat box, and you get details. Okay, let me say I want to ask about Buruli ulcer. So it tells me what Buruli ulcer is, definition, epidemiology, and clinical diagnostic clues. So Buruli ulcer can be found in children and adults, and the main lesion is usually on the limbs. So what about diagnosis and treatment? That's there. So you get for diagnosis, following laboratory tests, the FTLC and the PCR of skin swab or fine needle aspiration sample. And the treatment includes oral rifampicin and oral clarithromycin for 8 weeks. So you can see that it gives you a lot of details about how to manage the, on the field and what it looks like. And you can go back to the chat box again, chatbot, and say, okay, you saw a case of leprosy, for instance, and gives a definition of what leprosy is. The epidemiological and clinical diagnostic clues. Leprosy can occur in children and adults. The first signs are usually skin patches of variable sizes and are usually dry, color, maybe paler. So it defines what it's like. So what about diagnosis and treatment? So it tells you if leprosy is suspected, you have to test for sensory losses, palpate for enlarged peripheral nerve, and then to confirm the diagnosis necessary to do a direct microscopy or histology of skin slit smear or skin biopsy. And the current treatment includes multi-drug antibiotic therapy for 6 months or 12 months. So these are the details that you can get from this app, and it's really helpful. And so I would advise anybody, who's a health worker, particularly in rural community settings, to please download this app on their phone. If you're a public health practitioner or you're a community health worker, you're a community nurse, nurses, everyone, medical officer, everyone who works in communities, you may need the app at one time or the other. So please download it and just have it on your phone as a resource. So information. So this is just information about the scheme and about NTD and the purpose of the app. And then further information, it gives you websites where you can get further information on WHO websites and all. So that's there. Okay, so this is the WHO Skin NTDs app. So maybe we can take questions on this before we go to the Densa app or platform. Our Densa app is still web-based so that we can make all the corrections before we put it on the App Store. So we'll do that. Someone is saying the audio is poor. Am I audible? I know there's a bit of an echo because I'm using my phone. So let's look at the questions. I'm looking at the questions on the chat box currently. So Cole-Adeife Michael is asking, what's the minimal criteria requirements for a standard picture in dermatology? Close view, normal and distant view, as well as symmetrical view vital, as other associated lesions should be captured. Yes, this is very correct, sir. Thank you for this, sir. This is one of my organs. So you need to, the minimum requirements, usually you want a smartphone that has a resolution of at least 10 to 12 megapixels. And most cameras today have that resolution. You don't need to have a very high resolution phone like an iPhone or very expensive Android phone. But once you have a good smartphone, a recent smartphone, and it's one that was made in the last 5 to 6 years, most of such smartphones would have the required amount of resolution to be able to take a photograph that can be useful. So yes, so the other thing is a comment, which is very important, that a close view, a normal and distant view, like I mentioned, you have to zoom in when you have a lesion and an image. So you want to take an overall picture in a normal view or a distant view, then you want to take a close-up photograph of that. So maybe about 3 to 4 pictures, or if not more, for one particular skin condition will be helpful to make a diagnosis, and any other associated lesions. I apologize for the poor audio. I hope it's a bit better now. So somebody is asking, good evening, enlightening webinar. Please, is this in any way related to Canfield photos for clinical research? No, it's not related to Canfield photos for clinical research. This is just a webinar on how to report or teledermatology for skin NTDs that is being facilitated by the Nigerian Association of Dermatologists and is sponsored by the International League of Dermatological Societies and the International Foundation for Dermatology. Yes, so great but helpful, but how do we download this app? So I've shown how to download the app. I can show it again for those who maybe joined in a bit late. And then the app can be used offline. Yes. So if I'm going back now to the App Store, the Play Store. So this is the Play Store. You can just search for WHO Skin NTDs and you see Skin NTDs app. Click on it and install. Click on install and you have that on your phone. So that's how you can install it on your phone. So you can download it from the App Store. So the next question is, sorry, just a minute, let me look at it. Yes, can the app be used offline? Yes, it can be used offline. So that is, can be used offline. Thank you. So now we're going to look at the Densa app. So the Densa app is made, it was something that we try to work together and put together. And it's actually still under construction, but it's already functional. So I'm going to take us through the use of the Densa app so far. You can use it to send photographs to a dermatologist if you're not sure. So usually for now, this app is mainly for Skin NTDs, but if you're not sure, you can send a photo. It's still in what we call the beta trial. So I'm going to open it on my phone here. I hope it comes up. So just a minute. App.densa, just a minute here. I can actually use my laptop for this, but let me use my phone. So please keep the questions coming in. If you have any questions or comments, please do. So this is, yeah, so this is the Densa app. So the website address is app.densaapp.com. You can see that there. So it says, welcome to Densa. Now you can send a case to a dermatologist on this app. So if you go to it, it's not on the App Store yet. Like I said, it's a web-based platform for now. So it's online. Okay, so Dr. Ojile is saying the Skin NTD app is not available on the Apple Play Store. Are you serious? Let me check. I believe it is. I will check. But anyway, let's go through the Densa app. So you can open this on your phone. I would like us to try it out. So you can send a case to a dermatologist. So this is what, if you click on send to a dermatologist, this is what you see. You can put in your name. So for the purposes of this, I'm going to be Mrs. or Dr. T. And then my phone number, I'm going to put a fictitious phone number, 0909-333-71, just any number. Okay. Then an email address. So I need to put in a proper email address so that I can receive the response when a dermatologist responds. So when the dermatologist responds, you actually get an email to your phone with the response. So this is it. So I put an email there that I can use. So location. So this is where am I located? So let me just say for the purpose of this, I'm located in Kano. So full list of symptoms, just say skin rashes times maybe let's say for 2 years. And so I'm just doing a practical demo now. 2 years, ulcer times 3 months. 3 months. And this is a patient is, I should have put this first actually, a 56-year-old male, okay? So let's say this is what I put, but any information that you have that will help with making the diagnosis, you can put there. Then choose a file. Okay. So let's say I put, I want to select an image. Let's just put this image, even though it's blurred. Okay, so I've put it there, so I'm going to submit. So it's going through. Then it says case submitted successfully. Okay, so my case has been submitted on the app. So now I'm going to show you, if you can see, the Answer app has gotten a response or the email already. So I'm going to log in as a dermatologist now. Okay, I already have an account. If I'm a dermatologist, I can fill out this space and sign up as a dermatologist, but dermatologists will have to be verified before they can access the images on the image page. But so this is I'm just going to put in my account and go into the dermatologist section. So this is the image that I just sent, the skin rashes times 2 years, Dr. T. And this is here, so I can look at it, at the details. Dr. T, symptoms of skin rashes, 2 years, ulcer times 3 month patients is a 56-year-old male. So the dermatologist will receive this information. I can type a response here and say, okay, this may be leprosy. Please refer to the nearest dermatologist center. Okay. Center. Or, if it's scabies, they can actually give you like a treatment plan. If it's something that does not require further investigation, that can be done. These are other sample images that have been sent to the app before. So this is a case of scabies here that was sent as a sample. So skin rashes in the groin and in between the fingers, and this image was sent. And so the response was, this is scabies and treatment was recommended. Okay, and that is for that picture. This patient, this photo was sent of this patient with the details: adult female, 56, trader, skin rashes for 3 weeks, and the details. And then the dermatologist had responded here, this looks like a case of psoriasis. It is not leprosy, because the request was, please exclude leprosy. And you can refer to the nearest dermatologist. And also something has been recommended, like gentle soaps, petroleum jelly, and antihistamine for preliminary relief. Okay. Another dermatologist also confirmed this is likely a case of psoriasis. So this app is what can be helpful for people in rural areas. We are not sure what it is. So this is another case somebody sent in. So you can send in photos, but the important thing is that the photos need to be clear and they need to be de-identified. It's very important that the photos are de-identified. And I have to verify doctors, so I can verify doctors here to make sure that the person that is, signing in as a dermatologist is actually a dermatologist. So, but anybody can send images on the other aspect on the send a photo to a dermatologist. But please ensure that the images are de-identified to maintain confidentiality. And also that is the Dental app in a nutshell. There's also a place on the app where you can report notifiable diseases. And here it takes you to another web-based platform where, for instance, if you have a case of leprosy and you want to report it to your local health authorities and you're not sure who the person is or how to reach them, you can actually fill out this form on this app and an alert will go to the DENSA team, and the team will forward it to the state epidemiologist of your state, so that that case can be further investigated by the DSNOs. So this is also a useful resource. So you have your name, age, that's of the patient, gender, hospital number, department, and the health facility, whether it's public, private, the category, whether it's tertiary, primary, or secondary, then the symptoms and diagnosis, whether this diagnosis is clinical or laboratory. So if the diagnosis has already been confirmed with laboratory investigation, then it can be laboratory. So the name of the reporting health personnel, their designation, and their contact number, so that they can follow up with the case. So these are also a resource on this that can be useful for reporting notifiable diseases, and when you're not sure of the best way to go about reporting them, you can use this as a resource and all that. Of course, you want to, if you are putting a name, you need for this, maybe you won't put the full name, just put initials. That's it. Okay, so that is the DENSA app in the nutshell. So let's look at the questions. So thank you for this. Please, how soon can the response be on the DENSA app? So usually give at least 24 hours and the response will be obtained within them. It may not be immediate, but as much as possible, we'll try to make it as quickly as possible. So it all depends on how many dermatologists are signed in. I still try to present it to our colleagues so that they can join in and do that. Of course, it has to be in their own free time, so that's why it may not be immediate. So, but at least within 24 hours, it will be responded to. So that's the DENSA app in a nutshell. Thank you so much. So if we have any questions or comments, contributions, like I said, the DENSA app is not yet on the App Store. It's still under construction, but as you can see, I think it will be a very valuable tool for teledermatology and reporting notifiable diseases. And we are hoping that as soon as we have tidied it up, we can put it on the App Store. Sorry, my son is trying to give his own lecture. So you can actually use this. We can use it at the moment in our private settings or in our communities and see how it's useful to us. At least you have access to a dermatology opinion about skin lesions, particularly NTD lesions. We can expand it to include other lesions as well. But for now, it's mainly for skin NTDs and for rural people in rural communities. So that's very essential. So thank you very much. I would like to hand over to Dr. Oiwal to do the moderation so I can sort out this baby. Thank you. Dr. Oiwal, Dr. Nafisat, are you online?
Hello, Dr. Cole. Sorry about that. I was trying to unmute. Thank you very much for the presentation about the DENSA app and the Skin NTDs app. So, I think Dr. Cole answered some of the questions. If I remember, she stopped at the question on, somebody here is asking, good evening, Chief, the Skin NTD app is not available on Apple Play Store. So she mentioned that she was using a Samsung phone, and as such, she was only able to talk about the Play Store. So we will have to verify the about the App Store. Sorry about that. Then the next question is about, thank you for this. Please, how soon can the response be on the answer? She also answered that.
Sorry, Dr. Nafisa, I just want to answer about from the Apple Store. I'm looking at it on my iPhone right now. So just check for Skin NTDs app. Skin NTDs app. It's on the Apple Store.
So that's for the person asking about the iPhone, I guess. So Dr.
Yes, it's actually there. I just checked now on my iPhone. I have an iPhone, though I don't use it very often. But I've just checked and it's actually it's on the Apple Store as well. So you can download it there. Yeah.
There doesn't seem to be any other question, Dr. Cole. I don't know whether we can call it a day.
Yes, I think
you did
so.
mention
But I
that,
would like to make it a bit more interactive. So I would like to ask people if they want to raise their hand and they can try and download it or send a photo. That's what I was hoping that we'll be able to do. So if you have a photo on your phone, can you go to the Densa app and try and send a photo? So I don't know anybody who would like to try that out, and we can enable you to speak, maybe just for the next 10 minutes, and then we can close. I think somebody raised their hand. Pharmacist. I'm looking for it. That's fine.
We shared the link for the Densa app with them.
Sorry?
With the attendees.
Yes, you can just go to your Google and type in www.app.densaapp.com. Let me go to how you can do that.
Okay.
So just go to the www.app.densaapp.com. And it takes you to the Densa app page. So, I don't know if anyone would like to volunteer to do that. Let's see.
Any volunteers, any question? If you have a question, please kindly raise up your hand so that you can be unmuted. I don't know, Dr. Cole, whether it's you or I that will be able to see the hands that are raised up.
Yes, you can see them. I'm trying to look for the person who raised up her hand, but I can't just see the person. Like somebody did raise their hand.
There's a pharmacist, Pharmacist Moturayo is raising her hand or his hand.
Yes, so I'm looking for her on the
attendee lists.
Attendee list so that she can speak. pharmacy, but it's not. She's not there, so it's like she's logged out or so.
See her? I don't know what the problem is, but I can see her.
Can you see her?
Yeah, on the attendee list. Oh,
Okay, maybe you should
name has-
enable her.
no, the name has gone again now. It's appeared.
Yeah, so I
Maybe she
think
got
she's
logged out
having
or
network issues. So.
Maybe, yeah. Anybody else? Any other question?
No, Dr. Akola always is saying nice dental app. We can think of incorporating algorithm or AI that will integrate words and picture in the future. Yes, that's the hope and that's the plan. But first, we just want it to be a resource where people in rural communities where they don't have dermatologists can actually send in photos and get an expert's opinion on what it is.
Dr. Cole,
Yeah. Can you see her now? She said she's there, but
she was back. She was back. There are 3 people raising their hands. From Moturayo, Abisola, Ajak, Kai, and Mukhtar T. Suleiman. 3 people. I don't think I can enable them. You are the host. You are the one that will enable them.
okay, let me just enable.
Yeah.
Pharmacist Oshine, you are enabled now to speak and to be a panelist.
Okay, thank you very
Abisola
much.
Ajakai, you can unmute.
Hello,
Can you
good
hear
evening.
me? Good
And
evening,
Mukhtar
everyone.
Suleiman, you can unmute. Yes, we can hear you.
Okay, I'm
Okay,
Pharmacist
thank you.
Abisola Ajakai from Abeokuta. I just sent a picture to the Densa app now. I would like you to review the case and see if I
Okay,
got
great.
it.
Thank you.
Good afternoon.
Good afternoon.
Thank you very much for the presentation and all that you have been saying. I think my question have been answered while the presentation was going on. Some issues I think we might have with the app, but I just want to clear the fact that I'm around, I'm online, and I'm seeing everything. Thank you very much.
All right, thank you. Sorry, I'm just trying to log into my. Okay. So I'm here. I'm just going to log in again. Just a minute, please.
Hello, can we hear me? Hello.
Yes, welcome. You can hear you.
Okay, sorry, I just remember something again. I'm doing some surveillance engagement with WHO.
Yes,
Hello.
kindly go ahead. We can hear you. Kindly go ahead.
Okay.
Yes, we can hear you.
Okay, I work with Lagos State Primary Healthcare Board, but I'm engaged on one side as a surveillance officer with the WHO, local government for surveillance officer. At the last meeting we had at WHO, I don't know if you are aware of a Dr. Memuna Esson. Dr. Cole.
Yes, ma'am. If I'm
Do you
aware
know
of who?
Dr. Esson? Dr. Esson Memuna, the WHO surveillance officer.
No, I'm not.
Okay. She's the surveillance officer at WHO, and she's actually the focal person for NTDs in WHO Lagos.
Okay.
So I don't know, maybe later on might be needing a contact, since she's Lagos State Surveillance Officer for WHO. She's also the very focal person for NTDs. You understand? So
Okay, that's
I don't
awesome.
know. Probably you might be needing her contacts to liaise together and all that. Thank you.
Yes, please. Thank you so much.
Yeah, I might just contact you later on that.
Yeah,
Thank
may I
you.
come in, Dr. Cole?
Yes, sure.
Yeah, so thank you very much, Francis Oshineye. I think all the contacts that we can get very useful at this point in time, and that's also one of the purpose
Sorry,
for
Dr.
this training. That's also one of the purpose for this training, to harness all health professionals how to control and possibly eradicate NT. Interestingly as well too, on the side, we're also in contact with the country WHO officer on NTDs, that's Dr. Aliu Sulaiman, who we've also been working closely with. And it will also be nice to have the surveillance officer in Lagos and across all the states, so that would help the cross-cutting approach that WHO has recommended in the control and eradication of the NT. So thank you so much for this effort.
Thank you so much. Please, I would love to get the contact of the person so we can engage, and then you can be our ambassadors as well, which is also something else we want to achieve, is to create a community of people who work with NTDs, and we can help, to what the WHO calls the cross-cutting approach, and integration on the national level, so that we can all work together to ensure that we eradicate or eliminate a lot of these NTDs. So yes, so you can see that the photos sent in are here. I can see them. Someone called Peace sent in a photo. So this photo is actually quite well taken, and it's quite clear and detailed. Of this person has very dry lips, those kind of cheilitis, and there is a bit of a shadow, but we can see some perioral hyperpigmentation. So definitely not a skin NTD, but maybe this person may need some recommendations for improving their skincare practices. Yeah, so that's photo. So we can type a response, and we'll do that shortly. So this picture was sent in by Dr. Christian Etin Ekefre. Sorry, I pressed the wrong thing. And this photo is a 5-year-old male. The lesion appeared over a period of 2 weeks. Non-itchy, tender patch with raised edges. Okay. And this was sent by Dr. Christian. And this I can see is the axilla. The axilla of the child, as I presume. Yeah. So you can actually zoom into it and look at the lesions. So for this, we're thinking of fungal, superficial fungal, but a biopsy would to confirm or rule out other possibilities in this case, and then we can advise appropriately. Okay, so we can see that we can actually get a lot of the lesions here, and we can get a response and a review, and also referral to the nearest dermatology center if the person is not aware of that. So this is how it works. So thank you for those that sent in images and pictures. So that has really helped to demonstrate the functionality of the Denser platform. Thank you. So for each of these responses, I'm going to type something and then you will get an email if you send in your email.
Somebody was asking about sending the link for the App Store, the link or the app or the App Store, Apple Store. I also checked the Apple Store. I couldn't find it. Maybe we need to update or something for the person asking. I also checked the Apple Store and I couldn't find the app there. But maybe if we update, we'll be able to find it there. But Dr. Cole, I don't know. Do you think you can share the link?
I don't know how to share links from
exactly.
iPhone.
Exactly.
I just have an iPhone which I use as a backup phone. Let me see if I can get the link. But I went to the App Store and I just searched Skin NTDs app and it came up. So,
I did the same thing and it did it on my own phone. So I don't know how to use it.
That's interesting. Because I'm seeing it right here. I'm using my iPhone. Did you go to the App Store?
I'm there. And it's actually
okay. Did you check Skin NTDs app?
Yeah, that's what I wrote. Skin NTD app.
Skin NTDs app. Were you able to see it?
I've gotten it. Yeah, I've gotten it.
Yes. So it's Skin NTDs. Just type Skin NTDs app. No, sorry, not hyphen, space. Skin space NTDs space app. So it should come.
I also don't know how to share the link.
Yeah, I don't know how to share it from the actually.
So maybe okay, Mukhtar T. Suleiman is still has the person spoken? Mukhtar T. Suleiman. Somebody's
okay. I think I enabled him as well. Has he been able to speak?
Okay.
Sorry, Dr. Cole.
Yes,
on
please.
the Skin NTD app on Cole-Adeife, I think they can also access that using Google. We'll be able to get that. Maybe I'll just share that with her, see if that will help. Because even when you approach that using to access that, so I think that's another option for us to explore.
Okay, I can hardly hear you, Dr. Oiwo, but
yes, I thought I was the only one. His network isn't there.
Okay, can you hear me now?
It's a bit better, yes.
A little bit better.
Okay. Yes, I was saying that Dr. Ojile can access that using Google as well. I've tried to share that with her, the link with her, because it's available. So I think that would also help. But I've shared that with her, so maybe she should just check.
Thank you very much.
All right.
Dr. Cole, I'm not sure. I can't hear you. Am I the only one? Doctor?
Oh, sorry, I was muted. I didn't realize I was muted. So I said thank you. I think it's been a great time. Been able to demonstrate both apps, the Skin NTDs app by WHO and the Densa app. Hopefully, we'll be able to put them more to use, and this can help with the diagnosis of skin NTDs and then other things which may not be skin NTDs, but we can actually exclude, the possibilities of other of skin NTDs or diagnose other non-communicable or communicable diseases as the cutaneous diseases as the case may be. So Densa app is not on the App Store. Dominic, as I mentioned, it's a web-based platform for now. We are still working on it and it will soon be on the App Store, but you can use it as like a website. So it's like a website for now. So if you type in, I'll type in the website address, www.app.densaapp.com, and you can use it while you are online, just like the way anyone would use any web-based platform on their phone or their computer. So someone is asking, can I send a picture of NTD here for assessment? You can send it to the Densa platform. Yes, you can send it to the Densa platform. It will be on the App Store, and as soon as Densa is on the App Store, everyone that is registered for the NTDs program will receive a notification that it's on the App Store. So I think we have come to the end for today. Mr. Mukhtar Suleiman, would you still like to speak? Before we call it a day. Okay, he hasn't really said anything, so we assume that he's no longer answered all his questions.
Is live. What's this?
All right. Thank you very much. So we'll be wrapping up the series next 2 weeks. We'll have an overview again and a post test. So those who have been very consistent will get certificates for this program. We have a list of people who have made at least 60 to 70% attendance. So we can give them the certificates of participation. And we hope to continue to have a community of NTD ambassadors or NTD champions in our various localities. And can do that. So Chiamaka Nwigwe is asking, what is the name of the app again? Which of them? There's the WHO Skin NTDs app, and there's also the Densa app, which is currently web-based at the moment. But the Skin NTDs app is on the App Store, on Android, and on the Apple App Store, and can be downloaded onto your mobile phones. The Densa app is a web-based platform but it's functional and you can use it. Where is the chat box?
Dr. Cole, Pharmacist Toshina here is appealing that you kindly consider 50% attendance for certificates.
Okay, that is noted.
Then Dominic Izundu is also trying to ask, I can't find Denser app in Play Store. Anyway, I think you've answered that.
Yes, it's currently not on the Play Store, but it will be shortly, very soon. So I've put the link for the Denser app on the, and I'll also send it to everyone's email. Okay. All right, thank you very much, everyone. In the absence of any further questions, I think we can call it a day. Thank you. All right. Have a blessed day, everyone.